let's get into stem cell therapy. I've had a lot of requests for this over the last couple months. People are just confused. They're not sure. They're reading some research and articles and having conversations with people. They're just not really sure. Like, they're hopeful about stem cell. We're not really sure what it is or how it works. So I want to give you guys a very basic general understanding and try to demystify stem cells, the benefits, the pros and the cons, and everything in between. Sound good? Okay. So stem cells are this. It's an undifferentiated cell that's capable of giving a rise to more cells of the same type. So it's basically, it has no specialization. They come primarily from our bone marrow or our fat, and they go to an area that needs repair or regeneration for whatever reason. And then it assumes the identity of that cell or the cells in the area, kind of like a chameleon, right? Everybody see a chameleon change color based on its environment? That's what stem cells do. They don't have an identity. They have an identity crisis, all right? Then they go to the liver and they assume the identity of a liver cell. They go to the brain or the eyes, they assume the identity of the retina or the brain or the optic nerve. They go to the blood to form new white blood cells or red blood cells, so on and so forth. So is that clear? They kind of don't have an identity. Then they migrate to an area where it's needed for growth and development or repair and regeneration, and assumes the identity and becomes a mature cell of a liver cell, a brain cell, a heart cell, stomach cell, skin cell, whatever. Okay, we're all good? So from which certain other kinds of cells arise by differentiation? Again, what that means is, again, when it goes to that area, it's going to assume the identity of that specific cell. So there are really 4 types of stem cells, but inside of research in terms for our conversation, we're really going to stick to 2 types. The first is the embryonic stem cells, which we're doing a lot of research on these days. We meaning humankind. There's a lot of science research going on. Embryonic stem cells are taken after 3 to 5 days of when the egg and the sperm unite. It's about 3 to 5 days. It's a blastoma, and basically it's starting the early stage of development, and they're basically taking those stem cells from the embryo. The second is adult stem cells, which are taken from you. So my stem cells are taken from me, your stem cells are taken from you, your stem cells are taken from you, usually taken from fat or bone marrow. Okay? We'll get to this in a little while. My opinion, there's a lot of research on embryonic stem cells. Not as up on that is adult stem cell taken from our own stem cells. And we'll talk about why in a minute. So stem cell function, what do? Children, growth and development. That's why we have stem cells, right? I have a couple teenage boys now. They're kind of like starting to grow real fast and develop. Also for repair and recovery. But as adults, when we're fully we're full grown and fully developed, then we're just moving into stem cell activity for repair and recovery. That means we get hurt, we get sick, something comes up. We need stem cells to repair. Break a bone, cut ourselves, scratch, cut our fingernails, get a haircut. It's the stem cells that regenerate. Skin comes off, we got to regenerate new skills. So this process of breakdown and regeneration, stem cells head that process. Easy, right? So kids' growth and development, adults' repair and recovery. Clear? Good. So stem cell research, there's been a lot of research, 30 years now, give or take. It's slow, but there are some issues, but it is making progress, which we're very happy to see. There is some promise. Some areas are showing more promise than others. There's certainly a lot of research, especially being put out by the Foundation Fighting Blindness, a lot of contributions and money coming in for those types of research. And it is slow, but we do see progression, which is great news. The issue with the misconception around stem cell therapy for vision is that some people are under the false impression that it's going to recover dead cells, which it's not. All the research is very, very clear that at best it's going to slow down the progression, if and when it comes out to be proven as beneficial. Once dead cell is dead cell. Fibrosis, scar tissue, dead is dead. We know only one person who resurrected dead tissue. Or all-loving Dr. Frankenstein. But seriously, other than that, it's it ain't happening. So that's it. It's not going to come back if the tissue's dead. You can't reanimate dead tissue. So that's just to help people understand if there's nerve death due to trauma, acute trauma, or an episode or progressive vision loss due to whatever condition is going on. Whatever's dead is dead. Dormant will be able to recover, but dead is gone. So there are some risks of stem cell treatment that people aren't aware of. First and foremost is we're talking about the embryonic stem cells. The body can reject that. Why? It's not our own cells, right? Excuse me. When we do when we do organ transplants, what do we have to put people on? Yeah, people have to be on immune suppressants. You have to suppress the immune system so it doesn't reject the organ. Get a liver transplant or a kidney transplant or even down the line heart transplant. You're on immune suppressants because your immune system views that organ as not you, or that new structure is not you. So your white blood cells are going to attack that, beat it up, kill it, and get rid of it. That's why we have an immune system. So anything that's a foreign invader, in this case, non-me embryonic stem cells coming from somebody else, body's going to attack and destroy it. It's kind of a problem. That's why I'm not that big on embryonic stem cell. It's just, the body's going to seek and attack it. If you have a good immune system, boom. I'm not in favor of suppressing the immune system to get the embryonic stem cells going. I'd rather see using your own adult stem cells, again, from fat or bone marrow. My opinion, based on my understanding, it just makes a heck of a lot more sense. Another issue is systemic cancer proliferation. There has been a lot of incidents and studies that shown stem cells in adults can migrate towards cancer and cause cancer proliferation. So that's a big concern, especially if you have low early stage cancer and you're not aware of it. We all have some cancer cells and our immune system's constantly dealing with them. Immune system goes down, we got kind of early stage cancer cells, and we start loading our body up with stem cells. That can really activate proliferation. Not good. No bueno. We've had conditions where people did the injections. I had 4 patients here who entered a study down in Florida where they were getting injections of stem cells in their eyes. They're pretty good vision too, 20/40, 20/50 with retinitis pigmentosa, lost all their vision. Not exactly sure what happened, but they were in pretty good shape. And the injection, there was an infection. We're not 100% sure what happened, but the trauma of the injection or whatever happened, within days lost all their vision, couldn't even recover it. So it's a big risk. With our treatments, one of the criteria for the treatments that we offer here is safety. They have to be safe. That's my first criteria. Can't do any harm. May not help, and it's not going to for everybody. But the worst case scenario, we're not harming anybody. Stem cell right now is not really as safe as people think it is. So there are some concerns. It's not going to kill you, but if you have cancer, you can lose your vision. These are real things that have happened to people. So just to be aware, it's not to scare people, but again, we just want to make you guys aware of it. Infections, sudden blindness, again, injections. There's an eye trauma. I've had people with retinal detachments or bleeding, reacting negatively to the solution in the serum that it's in there. So, you're injecting a foreign body into your eye. Tissue overgrowth. So you bring stem cells to an area, you could actually have the liver start to hypertrophy and grow. Or you can have nodules and things growing on your body because you're accelerating growth. You're adding more stem cells. So that's possible too. You could have abnormal tissue growth. So these are just some things to be concerned about. In my opinion, one of the biggest things that conventional research is totally missing when it comes to stem cell is the environment. Here's why. Stem cells are like seeds, all right? Let's talk about gardening for a minute. In the winter, here in New Jersey, there's a reason we can't plant gardens and grow gardens outside. Of course, we could have greenhouse or indoor, but given that we're trying to plant a garden outside, the reason we can't is because the conditions aren't favorable. Too cold, not enough sunlight, not warm enough, so on and so forth. The environment has to be right to allow germination and growth of a seed into a plant bearing fruit. Okay? If the environment is not conducive or not healthy, the seed will not grow. Stem cells are seeds. All right? So if we have a toxic environment, talk about your eyes, if there's inflammation, poor blood flow, oxidative stress, buildup of metabolic waste, acidosis, just a not healthy environment, do you think stem cells are going to grow there? No. Do you think putting stem cells in there, even if I plant seeds in this polluted area, maybe if there's adaptation, if the cells are so wanting to grow that they go through a process of adaptation, you know, we see plants grow in pretty crummy places or harsh conditions, but there's a process of adaptation. Our bodies haven't adapted that quick to this hostile environment, and our eyes often will become a hostile environment. Other parts of the brain can become a hostile environment, the heart become a hostile environment, the pancreas, the liver, any place that gets sick, progressively sick and degenerating. The environment can't recover because the environment's too sick. So you got to clean up the environment first. Exercise, nutrition, eat better, reduce stress, alkalize your body, clean, get rid of the pollution. Then we have a better fighting chance at stem cells working. See? Also, it's my opinion that the majority of us are not deficient in stem cells. We're not. You know, maybe if you're really ill, severe autoimmune, or you're like 100 years old, it's probable that your bone marrow activity producing stem cells is not what it used to be. So our ability to repair and recover, as we know, with every decade, kind of decreases a little bit. But we still have stem cells. How do we know? My hair grows, what I have left of it. My fingernails grow. My skin replenishes. If I get a cut, it heals. Stem cells. If I break my leg, it heals. If I get a cut on my lip, it heals. So anything that, if I have an injury and it regenerates, right? I have stem cells. My body is responding to those injuries, and there's no lack of or deficiency of. Now, the problem with this is the environment is so toxic, the blood vessels are so clogged, and we can't get the stem cells to that environment, or because the circulation is so bad, or the environment is non-conducive to the stem cells growing. Those are the two issues. So in my opinion, it's not necessarily a deficiency of stem cells, it's just the inability for them to transport to the retina or the optic nerve of the eye or wherever else in the body we need them. And then on top of that, the environment isn't allowing germination and the stem cells to start to differentiate themselves and grow into healthy, new, robust cells. Does that kind of make sense? Clear on that, right? Not too far-fetched. So anybody here of epigenetics? Okay, epigenetics is new of a kind of a fancy term. A lot of research is going on around it. It's one of the coolest subjects, but it's also quite maddening. Basically, epigenetics says this: anything internal or external in our world in various combinations can trigger gene expression or cause disease or illness, or benefits. It could go either way. It could cause good or bad. So any bad combination of bad food or healthy food, drugs, good or bad, medications, things like smoking, exercise, sports, hobbies, activity, financial stress, recreational drugs, love, friendship, happiness, relationships, our thought process, how we think about things. So internally is our thoughts and our emotions. Viruses, bacteria. Externally, it's the weather, the sunlight, diet, foods, pesticides, toxins in the water, all these things that are external. All of these things in unique combinations can affect our bodies, right? So the problem is, say we're talking about something like RP, retinitis pigmentosa, or macular degeneration, or neural tension glaucoma, or anything that has a genetic component to it. So if you do stem cell or gene therapy that's addressing the eye issue, but you're not fixing the underlying cause, which, let's say it's Lyme, or you have a poor diet, you're eating McDonald's, every night, or you're taking medication, or you're super stressed, or you smoke, any of these, or you're a heavy drinker, or there's something that's, or you're out in the sun all the time, too much and not protecting, and the oxidative stress is, there are all these factors that can trigger the gene signaling to activate the genes, or if we go to try to recover that using stem cell or gene therapy, the underlying cause hasn't been regulated. So again, let's say, for example, Lyme disease. So I have Lyme disease, that's driving the gene expression, that's caused the switch for macular degeneration, RP, or whatever, just hypothetically speaking. So I do gene therapy or stem cell to try to recover that. But if, say, Lyme disease, which I've used that because I've seen that a couple times, if the Lyme disease is the epigenetic factor that's driving this whole thing, or stress is the thing that's driving this whole thing, or drinking 2 liters of Diet Coke every day with a bunch of junky other food and being stressed out and taking medication, if that culmination of lifestyle habits, thoughts, belief system, process, negativity is coupled with maybe a genetic predisposition or weakness, is giving rise to that expression, how much is those treatments going to do if you're not dealing with this underlying stuff? Make sense? So again, that goes back to the environment, the internal environment and the external environment. We got to clean that up so that people start to, that we can get a result. Even if we are using external stem cell therapy, it's going to seed better and germinate. Now, we mentioned earlier that acupuncture is demonstrating to be one of the best ways to get the body to promote stem cells. How does that work? Glad you asked. So how it works is this. Stem cells respond to trauma. Okay? In adult repair and regeneration, we have trauma. We get hurt. We get sick. We get injured. The body responds by increasing blood flow and loading stem cells to that area to repair. Okay? Makes sense? Because we have to repair that area. What is acupuncture? It's microtrauma. So it started in China about 10 years ago. They were injecting stem cells into the belly of people. I think it was embryonic at the time. And they were using acupuncture to guide the stem cells to specific areas of the body. So if it was somebody who had elbow pain, they're injecting stem cells and doing acupuncture all over the elbow to direct the stem cells to that area since they're flooding it in the body. They didn't really know this about the acupuncture actually stimulating stem cells yet, but we just knew that it was at least guiding because we know that stem cells respond to trauma. So it's almost like a feeding friend. It's like a Pavlov response. You ring the bell, they all start going to that area. Okay? So with acupuncture, we start putting needles in specific parts of the body. Microacupuncture 48 is one of the most powerful systems we found to do that, to stimulate the stem cell production. All right? We put the needles in, boom. It creates a little trauma. I know you guys get sometimes a little with the needles. We've also found that there are key points when we use electroacupuncture that get the same effect. So if we combine the microacupuncture with electroacupuncture, it has a huge release of stem cells. How do we know? We're measuring stem cell activity in the blood before and after acupuncture. So it's really, really cool. So what stem cells do, again, when we review, they reduce inflammation, which we know has a lot to do with a lot of these eye conditions. It fights apoptosis. So apoptosis is a huge discussion in the field of neurodegeneration right now. It's programmed cell death. So when we have accelerated apoptosis, the body's basically taking itself down and breaking itself down. This stops that process. It also causes, again, that differentiation. So we do some acupuncture points around specific acupuncture points around the eyes and other distal points that we know are going to stimulate the brain to say, pay attention to the eyes, get the blood flow, and get the stem cells going to the eyes. So we figured that out. All right, so we're going to have the cell differentiation. The stem cells are going to go to the eyes and start to repair and regenerate if we cleaned up the environment. That's why I tell you guys, watch your drinking, make sure you're sleeping, be hydrated, start eating a little better, start cleaning up your diet. This all stuff is going to clean up that environment. And then on top of that, the cells will replicate. When we get those cells in, the environment's good, we're going to have regeneration, replication of the healthy cells. That makes sense? So we put the acupuncture needles in, it sends a signal to the brain. Okay, I put some points in here, that gets the brain to respond. Then we put some local acupuncture needles in for the stem cells to target that area. Works. So people are asking, now I want stem cell therapy. I'm going to pay $25,000, $250,000. I'm going to Germany or China for stem cell. Go get acupuncture. There's certain types of acupuncture that will access and accelerate the production and distribution of stem cells. So there are certain types of acupuncture that we're teaching. I'm teaching my students how to do this, but that's how you do it. You know, get your own stem cells to do it and clean up the environment. That's what we're missing. So does that help demystify and clear up a little bit for you guys? Answer some questions about stem cells. It's really a big conversation. And again, we're really hopeful. It seems to be moving in the right direction. But in terms of what we're doing, why wait for stem cell? We talk to people all the time. We get emails, we're just going to wait for stem cell. We like, acupuncture sounds good, or supplements. We're just going to wait for stem cell. With all due respect, wait for what? Let your body start producing it today. Don't wait for somebody else to come out with a way to do it. There are ways that you can get now stem cells moving to your eyes to help repair your vision. So why wait? And you guys aren't waiting. Questions? Anybody confused? Does that make sense, what we talked about? Yeah.
How soon we can have it around already?
Working on it. As soon as we get an acupuncturist who comes in and gets trained. But we have acupuncture. It's just, we're getting the word out there. We just started heavy training over the last year or two. So it's just a matter of interest. Acupuncturists are hearing about what we're doing. They get interest. They want to come and train or not. So we're working on a directory of acupuncturists who are in different areas. So we're going to have like a map, like a heat map of where acupuncturists are down the line as we get more people trained. Yeah. Great question. So the laser is something we developed originally for children, laser acupuncture, and it was based on some German research that we found to show that increased the blood flow pretty much the same way acupuncture did to the retina and the optic nerve. So what we did is I got the equipment, the laser equipment, and we did a clinical trial where we had 40 patients, 42 patients I think, come, and we just basically did the same thing. Pre-testing, had them do laser. We either showed improvement or we didn't. The research showed about 80 some odd %. I don't remember the exact number, but I know it was in the 80s, just with the laser therapy. So we took it from just using it with kids to using it with adults. The only time I don't use it is with extreme light sensitivity. Some patients have a lot of inflammation, and that inflammation can create a lot of light sensitivity, photophobia. So with those conditions, is the only condition that I really won't use it because they're so light sensitive as it is. We need to cool the system down a little bit. But yeah, what it's doing is increasing blood flow, and it's also charging the cells. We're actually putting photon energy into the mitochondria cells. So we're actually charging up the cells like you charge your cell phone. Same concept. So the cells aren't, it's like your cell phone dies, you don't throw it out, you just got to charge it up. So that's what we're doing. That help? Yeah. Yeah.
You ever treat somebody with pulmonary?
Yes. So effective. They're actually using acupuncture and stem cell for that now. They're actually injecting when somebody has an acute torminous. So stem cell, to that question, is one of the best things for acute. It's going to be in all the trauma units, head trauma, sports medicine trauma, where it's already starting to make its thing. Chronic degenerative is tough. Why? For any condition, environment. Acute trauma, hey, all the first stem cell studies that were done, they were doing them on mice. They were basically chopping up their eyes or chemically radiating their eyes. They're damaging and traumatizing the eyes. Then they inject stem cells. Hooray, stem cells work for eye conditions. No, it's responding to the trauma. It does, but it wasn't for neurodegenerative, it was for trauma. So we know it works for trauma. I mean, there was a case that I read about 2 years ago about a fireman who burned, 89% of his body. He got caught, and some genius nurse harvested some of his stem cells, I don't know if it was from the fat or bone marrow, and sprayed him down 5 times a day. The guy was you almost couldn't tell everything grew back. His hair, his skin was normal. I mean, mess. 3rd-degree burns, was going to be disfigured for forever. Sprayed him down with his own stem cells, full regeneration. So for trauma medicine, I think that for brain trauma, TBIs, I think for spinal injuries, that type of stuff, like around the corner, stem cells. Neurodegenerative, a little bit longer. Why? Because of what we talked about. The environment has to be hospitable. And we have to be able to get the blood flow to that area. So the vasculature has to be there, and the environment has to be hospitable. But yeah, to answer your question, it could definitely help with meniscus. You can couple that with acupuncture and stem cell. It's good form rehab. Good? Yeah.
What's the best way to approach, say, an acupuncturist at home to tune into you that?
You interested in learning? Yeah. So I went to Andy Rosenfarb, or we're getting eye treatments. He's training students. If you're interested, hit him up. Some are, some aren't. Younger acupuncturists are usually. People are getting started. Like for me, there are certain conditions I'm not really interested in learning about. Like eyes is my thing. I do a lot of pain. I do some fertility, but there are certain conditions that it's not my thing. I'll refer out just because I'm kind of set in what I'm treating, and I'm really into this. So if you ask me to start, hey, you want to, start treating ear infections all the time, not so much skin stuff. Chinese medicine has a big part for dermatology. I can do it. I'm okay at it, but I'm usually going to refer out for that stuff. So somebody who's been practicing for a while often gets set into what they like, into their style. Newer practitioners are still trying to figure out what they want. They're looking for stuff. So a lot of my students generally are newer practitioners or older acupuncturists who are bored and they're looking for something else to get into because they've been doing infertility for so long or pain for so long. They want to try something new to keep it fresh. Yeah. Yeah. Great question. It depends. Bigger the mess, more to clean up. Like we go back to, try to clean up Vermont versus cleaning up New York City, or British Columbia or something like that. It depends on the person. It depends on what else is going on. Are they taking drugs and medications? How much work am I doing to clean my body up? So usually immediately, you start helping the body, the liver and the kidneys, the lymphatics, the gut, start cleaning up, detoxing. Weeks, days. That's why, most of our patients see some changes because we're giving more nutrients to the body. We're hydrating a little bit better. We don't overwhelm. Lifestyle changes take time. It's unless you're in a dire, desperate situation, often like cancer or something like that, or something where there's tremendous urgency. The majority of people aren't going to make a quick radical change. So we want to make people, we can't overwhelm people. Like you guys come in and I start giving you a book like this of to do. It's yeah. And I've learned that, giving you 1, 2, 3. I don't want to overwhelm you guys. If I give you 1 or 2 things to do, you'll do it. If I give you 20 things to do, just not. It's human nature. So we want to help you. Some people are more like, hey, give me more. And okay, so we'll get you on a little faster track. But I want to see consistency. Little things, little improvements, long-term changes. Not just like, well, I'm going to try this, I'm going to go back. I'm going to try this, I'm going to go back. I want to see slow. I'd rather see 2 things that are major changes than trying a bunch of things over the course of a year. That make sense? Questions? Well, I thank you guys for coming. I really appreciate it. I hope you learned a couple things and enjoyed, and thank you for spending time. And then we'll see you guys soon. Have a great night, everybody.